All right, okay. So good morning, everybody. So this could have been probably the first talk, and I'm sorry for that. So the indication for trabeculectomy has always been a threat to vision. So this is basically a very important concept that one need to understand. Sometimes it may not be really directly correlating with your intraocular pressures. It's sometimes we feel that, okay, only when you have 25 you have to go for surgery. But in advanced glaucomas it may not be so. Even the high teens is a risk factor for the progression of the disease. So in ocular hypertensives up to 30 is fair enough, but anything beyond 30 still the patient has a threat to vision. So we got to understand that we have to go for the surgery in few cases. So when you have the threat to vision, there is no other options available for you, like unavailable or inappropriate options or very ineffective, then one has to always look at the surgical option as the primary option. Though we said the IOP is not every time, but almost always IOP has a component to play in the threat to vision concept. Looking at the preoperative glaucoma assessment, we all are good at doing our appellation tonometers, but then the time of the day, and you see how much is the fluctuations the patient is having, or is the disease is truly progressing, or you are just looking at the artifacts and you are just trying to decide on going in for surgery and try to understand what is the rate of progression. Some of them are quite fast, rapid progressors, some are very, very slow progressive disease. So we have to always think about the balance of the risk-benefit ratio, and then you take a decision on whether to do the surgery or not. So the threat to vision has some multiple components like age, intraocular pressure, the degree of damage, the other treatments unavailable or unsuccessful, poor compliance, the progression of the damage. So everything plays a critical role. So just looking at the intraocular pressures, I just told you that multiple measurements are going to be the key. Just one measurement is not enough for us. So IOP is the surrogate for the reduction of the threat to vision. Artifacts we have to understand, like the corneal thickness values, though we don't have any precise way of countering these CCT values, but then we have to understand that there is a diurnal and nocturnal fluctuations also plays a role in progression of the disease. But many times it may not be really possible for us to just look at that and then go for the treatment. And of course we have the high IOP can cause the sufficient damage to the optic nerve head. So the degree of damage, one we assess by structural damage by looking at the OCT pictures, and of course we have the functional loss looking at the visual field. So you see which patients are progressing much faster than the other patient, and then you can take a call. So the progression plays a critical role in your decision making. Looking at the disc, looking at the visual fields, looking at the OCT, everything plays a critical role in understanding. So many times we look at the patient, whoever is younger, probably they need to protect, you need to protect them a little longer enough, because say for example 40 years, we always calculate at the age of 90, looking at their lifetime. So at least 40-50 years of time that we'll have to take care. But don't underestimate some people, whoever is 75, it is not necessary they have to die in another 5 years time. So they can live for another 25 years. So we have to be a bit careful about it. So the poor effect of medical therapy due to various reasons, like IOP is too high where the medications are not effective, secondary glaucomas, pediatric glaucomas, all these things will never get controlled with your most of the medications. So the non-availability with the patient, it could be because of his economical status. Maybe he is not able to buy, medication is not available locally, or even medication is not available from the company itself, like what has happened to the pilocarpine therapy. So the other concept is called as optimum medical therapy, or rational medical therapy, or maximum tolerated medical therapy. So we have to understand this concept. It is not that, okay, you have 5 medications, you can give the 5 medications. It is not so. We have to understand what is the maximum that we can give it for that particular patient. So intolerance to medical therapy is one of the major risk factors for the progression of the disease, where it is one of the main indications for your surgery. So the take-home message is there are a few absolute indications, like where the progression you have seen definitely by looking at the visual fields or the OCT or the combination of things, And the polypharmacy is one of the major things that you will have to look at. And if you are not getting the target IOP under your control, then we'll have to definitely look at poor compliance, especially in Indian context. Poor compliance is one of the major risk factors for the progression of the disease, where we have to kind of go for it. Economic considerations, though I put it as a relative indications, but still I feel in our country it is one of the main indications that we have to go for the surgical option, especially the trabeculectomy, once you are trained enough to do so. Thank you so much.